Hi everyone, my name is Audrey and I am a senior here at Miami. My complex problem I chose is language barriers in healthcare. This complex problem is especially important to me since I work in healthcare and hope to continue working in the medical field someday. Language barriers occur in healthcare when the healthcare worker, usually a doctor or nurse, and a patient do not speak the same native language. This is an important issue to address because it contributes to healthcare inequality and lowers the quality of care for affected patients across the world. Language barriers cause miscommunication between the doctor and patient, which decreases the quality of care and prevents proper treatment to be provided. Trust between healthcare providers and patients is also crucial to delivering the best quality of care possible. When a language barrier is present, trust is harder to establish. Even language barriers between patients and secretaries or other office workers can result in patients missing appointments and not receiving care. Patients who do not speak the native or common language of the area they live in may also be intimidated to seek out medical care and avoid it altogether. In the United States, this language barrier in healthcare most commonly occurs between English-speaking healthcare providers and Spanish-speaking patients. Communities with higher populations of Spanish-speaking residents are especially affected by these language barriers, such as in California or Texas. According to the Association of American Medical Colleges, or AAMC, only 6% of doctors in the United States identify as Hispanic, and only 2% of non-Hispanic doctors speak Spanish, which creates this language barrier. However, language barriers within healthcare is a global problem outside of the United States and is seen across the world. The first example I want to mention is from the Journal of Communication in Healthcare. In Ghana, this issue is seen between two language minority communities in the Volta region of Ghana and their healthcare providers. Patients in these communities spoke in their native languages, Saidame and Tegbor, while healthcare workers used English, Akan, and Yu. This language barrier inhibits patients from receiving high-quality care and prevents providers from delivering client-focused care. Another example is from the BMC Health Services research. Addis Ababa, Ethiopia, is another specific community that suffers from language barriers in their healthcare system. Although this is the capital city, an important location within the country, Amharic is the only language used in work settings, including healthcare. This causes Afan Oromo-speaking patients to encounter language barriers that negatively affects their received care. A final example of language barriers in healthcare I want to talk about is seen among migrant women in European countries. This is a more broad example that was researched in the Journal of Midwifery and Women's Health. When accessing reproductive and sexual health services, migrant women have reported, in European countries, that they feel feelings of anxiety, fear, etc., due to them not speaking the same language as providers. These examples from published research shine a light on the issue of language barriers in healthcare and prove that this complex problem is global, not just seen in the United States. I now have a better understanding of how language barriers in healthcare are seen not only within the United States, but across the world. There are various solutions being discussed by healthcare providers and other researchers to solve these language barriers in healthcare. Translators seem like the most plausible solution to solve the issue of language barriers. However, a third of hospitals in the United States still do not have translators. Even with a translator, miscommunication can still occur, and it is still challenging to have personable and trustworthy interactions between providers and patients. Next, medical schools are encouraging medical students to learn Spanish and providing classes for students to take. Some medical schools are even requiring medical students to take classes to learn Spanish as part of their medical school curriculum, especially in highly populated Spanish-speaking areas in the United States. This is great for medical students that already have a Spanish-speaking background. However, the majority of medical students in the United States do not have a Spanish background, which makes it difficult for these classes to be effective. Lastly, the solution with the most potential is the use of technological tools such as apps and computer programs. However, it can be difficult to create high-quality translations of medical-based language between languages. Medical-based language used in healthcare is obviously very complex and has been proven to be difficult to translate into different languages. In conclusion, language barriers within healthcare is a very prevalent issue across the world. Language barriers can cause miscommunication between healthcare providers and patients, leading to poor quality of care and ineffective treatments. Individuals that do not speak their residents' main or popular language may avoid seeking out care altogether. Although translators seem like the plausible solution, other solutions such as computer apps may be more effective in reducing the negative impact of language barriers. Regardless, if healthcare systems find a solution to overcome these language barriers, healthcare providers need to research and learn more about patients' cultural backgrounds, social norms, and body language in order to better communicate with them and provide the best quality of care possible. Thanks for listening.